Hello and welcome to Altrika's GMP accredited clean rooms. We would like to give you a brief introduction to this facility. In order to enter the facility, appropriate clothing is required. Outer clothing is removed and replaced with cleaned undergarments. Here we have a tunic and some trousers. We then add a hairnet to make sure that no hair enters the facility, and we have autoclaved clogs. The first pair of gloves is then used. After this, we have a cap which covers the head and shoulders and is sterile. We then have a sterile suit which goes from the head down to the feet. After this, we have some individually wrapped shoes which are toggled up to the knee. We then have a mask and an outer pair of gloves. I'd now like to hand you over to Vanessa, who is a supervisor for My Skin and Cryoskin, who will take you through the facility. As you can see, Vanessa is wearing the appropriate clothing as I've just described. We have two rooms in our clean room facility. I'm just taking you into the first room now. The two rooms are necessary because we do two different types of work. First work is patient work. This is mostly the My Skin work. And we use antibiotics in this, and each of the patients may have different infections or conditions that we need to keep separate from each other, basically. So every time we do any kind of patient work, we first off start it off in the quarantine hood. So we have two hoods in this room. The first one is the quarantine hood, and after every single patient process, we make sure that we biocide that and completely decontaminate it to ensure there is no transfer of any kind of microbes or viruses from one patient to another. We also have a separate quarantine incubator down at the bottom there that we keep the patient cells in separate. Once all of the virology and sterility checks come back, then we can process them in the second hood, and we keep the patient cells in a clean dewar as well. The facility itself, each process that we do is monitored for microbiology, and we have a series of microbiology plates, agar plates, that we use to continually monitor the environment, both in the room and in the hoods that you're working in. The facility itself is monitored weekly by an external contractor who come in and do particle counts and microbiology counts to ensure that we are running to the appropriate GMP standards. When you transfer anything into the clean room, everything has to be wiped in first with alcohol sprays and with biocides to make sure that you're not transferring any microbes from the storeroom into the sterile environment. And also, when you go from taking anything into the room and passing it into the hoods, again, everything gets sprayed down with alcohol. So this one's the My Skin room. Next door we have the Cryoskin room. I can't take you in there at the moment because we currently have two production batches running. It's pretty much exactly the same facilities, but in the Cryoskin room we don't use any antibiotics, and so we have to maintain an extra level of sterility. So we only go in there when necessary, only trained personnel are allowed in that room, and we try and keep contact to an absolute minimum if we have any production running. We have two hoods in that room and two incubators. Everything that we do is documented. Everything has appropriate forms that we need filling in to document every single procedure that we do. and that's all to GMP standards as well. And we work as closely as we can to ISO 9001 for that.